Hello, my name is Dr. Robert Fromm, and I'm the Chief Medical Officer at Maricopa Integrated Health System. Today, we're talking about the new legislation, the Affordable Care Act, and specifically we're going to talk a bit about the insurance elements that come into it because of the Affordable Care Act. We're fortunate to have Dr. Betsy Thompson with us. She is the Chief Medical Officer for Region 9 for CMS, very knowledgeable in this area, and we have an opportunity to pick her brain, if you will. Betsy, thanks for being with us.
Oh, I'm happy to be here. Thank you.
Will everybody have health insurance under this program?
Not quite. So we know that depending on how you count the population, we have between 40 and 50 million that are uninsured currently. If every state were to expand Medicaid, between the Medicaid expansion and the ability to purchase on the marketplace, we'd cover about 32 million of those. There's a lot of different ways to look at this issue. So that's one. Is it fully implemented? There would still be some individuals who would not be covered. There are some individuals who aren't eligible for the marketplace. So because the main eligibility criteria is that you have to live in the service area of the plan. You have to be either a U.S. citizen or a national, or you have to be lawfully present in the United States and not incarcerated. So those are the main eligibility criteria. So obviously people who are here illegally do not qualify to purchase on the marketplace.
Okay, so in closing, it seems like there's an opportunity for many, many people to obtain coverage under this element of the Affordable Care Act. Not going to cover everybody, but certainly is going to be a larger population that is currently covered. Where do we find out more information about the Affordable Care Act and specifically the health insurance exchanges?
I'll say again, the main source of information for the consumers is healthcare.gov. There's a lot of information on there already. There's a tab up at the top that says Learn. You click on Learn. And on October 1, you'll be able to enroll there as well. And that's a place for both individuals and small businesses to go to learn much more about it. For provider groups and individuals who may be assisting others to enroll, that want more detailed information, maybe want to print out something to put in their waiting room, or just want a lot more information than what we've been able to cover today, they can go to marketplace.cms.gov for a wealth of information there as well. But the public really needs to be steered towards healthcare.gov. They can also call our 1-800 number, 1-800-318-2596. Great thing about that is it's already staffed now 24/7 and will continue to be so. There are English and Spanish language operators at all times, but there's also a language line with 150 additional languages. So language really should not be a barrier to people. There will also be much in-person assistance available starting next week, and you'll be hearing a lot more about that from all the local individuals that are doing this work, including librarians, community health centers, hospitals. So lots of people will be available in person as well. You know, I just would like to say a couple things about what this really means to us. I think it really is a historic point in healthcare. You and I have both been in the healthcare industry for a long time, and this is, I think, arguably the largest event and largest increase in expansion and access to coverage as well as care that we've experienced since the initiation of Medicare in the 1960s. So I think it's something very good for our patients. It's something very good for all of us as providers, and I'm really looking forward to the next few months.
Well, thank you, Dr. Thompson, for all this useful information, and I'm sure this will be helpful to our listeners.
Thanks.